Hi, I'm Jennifer Allen, reporting for RSNA News. I'm talking with Dr. Judah Burns, Program Director of the Diagnostic Residency Program at Montefiore Medical Center and an Associate Professor of Radiology at the Albert Einstein College of Medicine in New York City. We're talking about the debate between the use of narrative versus structured reporting, and especially the move toward the latter, which may be beneficial to aspiring radiologists. Thank you, Dr. Burns, for joining me today.
Thank you for having me, Jennifer.
Can you explain the difference between narrative and structured reporting in radiology?
Sure. Narrative and structured reports have similarities and they have differences between one another. Narrative reports are more traditional. They're more free-form and organized by the individual radiologist, which really reflects the radiologist's sense of what is normal and what is abnormal about a study. They can be thorough, but they're not as standardized. In contrast, a structured report is more organized, and that's often associated with the use of a standard reporting template. They therefore have a more uniform style, which helps to both organize the abnormal and the normal findings. And as a result, you get a more complete and consistent report. And that really helps and facilitates comparison between reports. This is an especially important opportunity when you think about disease-specific reporting templates, which are more consistent and help add more clinically relevant detail to specialized reports.
What are the benefits of a structured format for radiology trainees?
In the training environment, having a structured format offers many benefits for residents and for fellows in more advanced levels of their training. Having a narrative template and a checklist of key anatomy and imaging findings can be especially helpful. From the perspective of residents, benefits include teaching them how to develop a search pattern to go through their imaging. It allows them to both make the findings and avoid some tricky blind spots. It also trains them in report organization, helping them arrange the thoughts in a more flowing pattern. Other benefits allow them to identify critical anatomy, key imaging findings, and especially helps them identify common complications of disease that they may encounter. And this is especially true when using specialized reporting templates.
Are there any potential drawbacks to structured reporting in the radiology training environment?
Sure, there can be, but that shouldn't detract from the adoption of structured and more organized reporting formats. Having an awareness of these drawbacks can help residents avoid the pitfalls and help them maximize the value of using structured reports in a training environment. And these drawbacks can relate to both the interpretive and the dictation elements of a resident's experience. For example, on the interpretive side, using structured reports may impede the development of an independent search pattern for residents. When they use structured reports, their reports may lack the specificity and depth that they need if they rely on pre-populated templates. So these are important elements for a resident to really think about. When you think about the stylistic elements of a report, using a structured report could promote a more formulaic or restricted dictation style, and it really can confound the reporting of more complex cases. Importantly, of course, structured reports also allow the permission to retain template-related dictation errors, where the resident fails to remove a structured normal statement when also including their abnormal statement. But of course, this is a problem that both residents and attendings may have.
What are the benefits of a hybrid structured report?
Well, a hybrid report is really an attempt to overcome some of the limitations of structured reporting. And it attempts to employ strategies which overcome both the stylistic and other barriers. And this is always going to be tailored to an institutional's own preference. So for example, a program may choose to use a resident-specific template, which has blank sections and pick lists of normal findings. This promotes the resident to use a narrative description when they come up with an abnormal finding and encourages them to describe it using their own style and substance. But at the same time, it offers the resident a vetted example of what a normal report should look like in the case that the findings are truly normal. And by doing that, it really encourages the residents to first assure that the findings are truly normal before selecting the normal portion of the template, and when they are abnormal, to describe them thoroughly and completely. I really think that being mindful of the drawbacks of structured reporting helps residents produce better reports. And at the same time, it also helps faculty train residents and offer them greater feedback on their reporting style and substance.
Thank you for the great information today, Dr. Burns.
It's been my pleasure. Thank you so much for having me.
For more radiology news, visit rsna.org/news.